Hi, my name is Andrew Springer, chiropodist at the Foot Advantage in Oshawa. I'd like to talk to you about an essential service that we offer, known as wound care. Foot wounds, often known as ulcers, are a serious concern, particularly if you have diabetes. High blood sugar can damage nerves and blood vessels, making it harder for wounds to heal and increasing the risk of infection and complications. Even a small blister or cut can quickly become a serious problem if not managed properly. 85% of lower extremity amputations begin with a wound on the foot, and 80% of those amputations are preventable. At the Foot Advantage, it is our goal to help all our patients learn how to live well with diabetes. At our clinic, wound care always begins with a comprehensive assessment. We check your medical history, we examine the wound, we look for a cause of the wound, and we look for risks that you have for developing further wounds. As successful treatment of wounds is always done by a team, where necessary, we communicate with your doctors, your nurses, and make sure that everybody is on the same page and in the loop, helping your care move forward. Our role in wound care includes several key components such as debridement, that is removal of unhealthy tissue that prevents or slows healing, recognizing and treating infections, offloading pressure that can slow healing, and advanced therapies like red light therapy and laser therapy. Timely referrals to appropriate caregivers can literally be a lifesaver. Wound prevention is also key, and certainly more desirable than having to treat a wound. We use research-validated evaluation tools for wounds, but also to identify existing risks of developing a wound and then discussing strategies for addressing the risks and preventing wounds. If you know the risks and we're able to address them, you have that much less to worry about. Education is also a big part of wound care. We'll teach you how to manage your wound at home, how to prevent the wounds, how to recognize infection, the appropriate footwear to have, all the things necessary not only to help you heal, but to prevent further recurrences of wounds. When a wound heals, it takes 1 to 2 years for the skin to regain its full strength. And even then, it's only 70 to 80% the strength of normal. So it's really, really important that you know how to take care of and recognize any risks or catch anything early that might be going on. If you have a foot wound, don't wait. Early intervention is key to successful care. At the Foot Advantage, we are committed to providing expert, compassionate wound care to help you heal, stay active, and maintain your mobility. If you have any further questions, contact us, email or telephone, book a consultation. We'd be happy to assess you and assure that you get the proper care for your needs. Thank you for watching. If you have any questions, feel free to leave it in the comments below. I look forward to seeing you at the clinic.